County. We now want to speak to the Chief of Staff of Meru County, Mr. Gideon Kimathi, who is here on behalf of the Governor, who had to travel to Nairobi to make arrangements for the Building Bridges Initiative meeting happening here next weekend. Thank you so much, Bwana Gideon, for making time for us.
Thank you so much, Edmond.
We've just had a story on Miraa, which is one of the cash crops in this part of the country.
Yes.
And the issues that came out of that are the unstable markets.
Yes.
Mombasa County being one of them, and they've imposed very high taxes for you to be taking your product there. Are you considering perhaps negotiating with them?
Thank you, Edmond, and thank you all the viewers. Miraa is a very, very good crop for Meru, and not only for Meru, but for the entire country and the entire region. And of course, the counties came into effect so that we can be able to facilitate our people to be more productive and also to be able to market our goods. It will be prudent for us as a country if, as counties, we assist each other so that our unique products will be able to get market into the sister counties, and then we also facilitate so that their products, their goods will be able to get market in our place. So you are right, we have a problem or rather a challenge whereby like Mombasa County has imposed some taxation or some other restrictions, which we are also looking at so that we talk with our county, because it is also in their interest that we have that mutual understanding, we have that mutual cooperation. And you know, our Governor Kiraitu Murungi is somebody who is able to reach out to the other leaders so that they can agree, they can understand, they can read the parameters that are there. And it's something that we are doing also through our county assembly. They are also trying to reach out to the county assembly of Mombasa and other areas so that such legislations can be stopped, because it is in the interest of our country that each and every county does a legislation that in effect will not hinder commerce of the other county. Okay. So it's something that we are considering looking at. For those who consume this plant, it's usually actually as raw as it is. Are you perhaps considering value addition and stuff actually, like that? You're right. For a long time, Edmond, this commodity has been taken raw. I saw you guys in the field today, and I admire what you're doing there. But through our Meru University, we are doing research, and also through JKUAT, some research have been made, and we have value addition going on so that we can package Miraa, we can have Miraa juice, we can even have sweets from Miraa, because if we do like that, then we are going to make sure that our farmers get more value for the crop, rather than when it is being ferrying like this. You've seen the vehicles, how they move very, very fast. I think when we do value addition, we also try to help the transportation, then drivers, and all the rest. So it's something that we are doing. The county government and Governor Kiraitu Murungi has revamped the Meru Investment Development Corporation, which is the investment arm of the county government of Meru. It's a unique arrangement as an independent body, and this is a body that does value addition not only for Miraa. It is looking at value addition for Miraa, for bananas, for potatoes, and all those other crops. So Miraa is part and parcel of the crops that we are doing value addition. Okay. One of the stories we've been covering here concerns the burden of cancer in this county. And the Meru County government has been developing the Meru Level 5 hospital, and this is a report that was filed by Melita Oletenges. Let's have a look before we have this discussion.
Construction is currently ongoing at the Meru Level 5 hospital. The 4-story building expansion of the inpatient wards is expected to accommodate 600 patients. It currently holds 300.
We are looking to expand capacity. We are looking to have modern facility for patients, because we believe that in the year 2020, public facilities should be better, if not at par, with the private facilities, so that we provide care to our patients.
A 15-bed renal unit and a 10-bed ICU unit are also under construction.
We will be completing our ICU by April. It will be operational. So we want to reach a point where we are not having to put our patients in ambulances and take them for intensive care in Nairobi and in Kenyatta Hospital. We all know that that also causes strains in Kenyatta National Hospital.
The hospital has also procured state-of-the-art equipment for different departments, including this biosafety cabinet that is used for chemotherapy drugs and these chemotherapy chairs at the oncology department.
We look at mass screening for the population here. We also have diagnostic services available at the County Referral Hospital. We have treatment options available for patients, which includes chemotherapy and some targeted agents. We, however, have to refer our patients to Nairobi for radiotherapy. And then we have palliative care services within the hospital and also in some of the sub-county hospitals. And we are lucky in Meru that we have Meru Hospice that is available to the patients.
The Meru Level 5 hospital gets referrals from the Upper Eastern region, numbering over 3 million patients annually. With its expansion, the hospital will offer better services to the people and much closer home. Melita Oletenges, NTV, Meru.
The concern in this is cancer, and just yesterday we had the Mount Kenya run to raise funds to set up a cancer institute within the Level 5 hospital. How will this be set up, and what sort of benefits and services will you be offering to the members of the public?
Thank you, Edmund. I want to first of all thank you, NTV, and all the other participants who came out yesterday, because we are one of the most successful mountain running events in the world. You realize it has never happened again in this region.
Yes.
And as the governor and intimated, the kind of support that we got from institutions, from sponsors was immense. And what we are trying to do from the proceeds is that we want to look at cancer, because Meru County is ranked highly in terms of prevalence of cancer, which is not a good number anyway. And we are trying to look at situations whereby we can set up the Meru Cancer Institute. One thing, it will do research so that we know what is this cause, what is the cause of this high prevalence of cancer. Then we also want the Cancer Institute to educate our people so that we can do preventive approach or strategies rather than curing cancer. Secondly, we also want to look at those people who have cancer. We identify early enough before it is too late. Once we identify, then we are going to put them on treatment, and we are sure when we use all those strategies, we are going to reduce the numbers of the cancer patients in Meru.
Okay.
Meru Level 5 is a place where we want to put the Cancer Institute, and just this week, the cancer clinic was opened. You saw the first lady is there, led by our very own first lady, Priscilla Muronge. They have set already the cancer clinic, and we also do a lot of ground checks. We go to the ground, screen, but the governor always asks us to ask ourselves one question: after you screen, what next?
Okay.
And that what next is what we want to answer through the Cancer Institute that we are going to set at Meru Level 5.
Meru has a landmass of over 6,000 square kilometers and a population of 1.55
Yes.
or a million or thereabout. Surely
Yes.
that is a very big number. If
Yes.
you're going to be doing screening,
Yes.
and you have just one facility, how are you going to do that?
No, screening will go on at our dispensaries, health centers. We shall be doing screening. But what we want to do is that at least we have one center whereby all services related to cancer will be offered. Okay. You know, cancer treatment is expensive. It will not be very easy to start with to say that we are going to have cancer centers in each and every health facility.
Right.
But at least once we do screening, where do we take them? Right now, if you want treatment, people will go to India. But the governor is asking himself one question: how many people are able to go to India? Okay. So instead of empowering people, or rather than doing a Harambee so that people can go to India, selling land so that people can go to India, or Nairobi Kenyatta National Hospital, can't we have our own Kenyatta National Hospital here at Meru Level 5?
Another big issue, and this is not just unique to Meru County, is the issue of youth employment. And
Yes.
Meru County has actually started a model set up kind of youth service that replicates what we have at the national level, the National Youth Service to employ the youth, and about 2,000 are actually graduated from that training. Let's have a look at that. The initiative has so far seen about 2,000 youth graduate from the training. The program is intended to complement the national government's efforts towards addressing the 18.3% youth unemployment rate. The Meru County government is viewing the program as a means not only to keep its youth out of trouble, but equip them with technical skills. An inspiration in step with the national government's campaign to see more youth vocationally competent.
Ama si lazima ukue umesomea kitu kubwa sana ndio upate kazi. Kuna kazi mingi huku nje. Tulikuwa na wengi ambao walifanya constructions, building, wakafanya plumbing. So kuna kazi huku nje. Acha tujaribu kama youth tusomee kila kitu, technical courses tufanye. Juu ndio kazi na kuria kama kosi ya mikono yangu.
The first 2 weeks of the program are dedicated to building the cohort's mental strength at a training center in Igoji before receiving artisanal training in centers across the country. The trainees have been recruited from all of Meru's 45 wards.
Because of this training or this initiative that Governor Kiraito has started, we will be able to keep ourselves out of like robbery, drug abuse, and in our society we will also be people who are respected because they are not depending from their society, but the society is depending from them.
In 2018, 400 youth graduated as community health volunteers. The last cohort of 600 graduated in December 2019. So that's 2,000 of just a very huge number of the youth here in this county. What are you doing with the rest in terms of formal and informal kind of employment to benefit them?
Okay, thank you. Meru Youth Service.
A little bit lower than that. Okay, that's okay.
So Meru Youth Service is an initiative from the governor of Meru and the county government of Meru, because right now we have so many young people unemployed, and the governor normally says that our young people are actually unemployable because they don't have skills. So the 2,000 that you've seen as Edmond put through the system is that these people did not have an opportunity at all. Some of them, even after standard 8, they did not get an opportunity to go to Form 1. Others went to Form 1 up to Form 4, and they couldn't go anywhere else. So what we've done is to offer them skills. We do training for them. We do mindset change for them, so that they have at least hope in life. Secondly, we take them through our polytechnics. We train them. They are mercenaries, they are plumbers, they are people who are doing hospitality, all those kind of skills. After that, now we can be able to release them to the job market. Some are employed in the hotels, some are employed in where we have constructions. And then we have another group that has not been able to benefit from the Meru Youth Service. And this is a group now we intend also to benefit once this the call for we have, even through the BBI, that we ensure that we involve much more resources. We have just taken care of 2,000 young people because the resources that we are getting as a county government are also not very, very adequate. But once we get enough resources, we are going to get many more. Number two, the youth who are in the bonda sector, who are in the small scale employment, we are also helping them through the Meru microfinance, whereby we are offering them resources so that they can be able to employ themselves and change their lives. So we are looking at the youth at the broader perspective, not only the Meru Youth Service.
Thank you so much, Bwana Chief of Staff Gideon Kimathi, speaking to us this evening on behalf of the Governor Kiraito Murungi on the issues of development and the issues that affect the people of the great county of Meru. Thank you.